Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie.
And my name is Sara.
And we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi again, and welcome to the Gritty Nurse Podcast. This is going to be a really good episode, and I'm actually really excited because you know what? This is one of the nurses, to me, is like a celebrity because I learned about her in nursing school. I'm sure Sara has too, but Sara, please introduce our guest for today.
Yeah, before I introduce our guest, I'm going to say I'm having sort of a fangirl moment as well.
Yeah.
I have a friend actually who finished the social work program a while ago, and she even knows Cathy. So I'm just going to introduce her. We have Cathy Crowe today. She is a longtime street nurse who works in the area of social justice nursing. She is a frequent speaker on subjects related to homelessness, housing, advocacy, activism, and social justice. She is the author of Dying for a Home, Homeless Activists Speak Out, and A Knapsack Full of Dreams, Memoirs of a Street Nurse. She is the subject of the film Street Nurse and has also produced several films in the Home Safe series on family homelessness. She is a public affiliate in the Department of Politics and Public Administration at Ryerson University, and she received the Order of Canada in 2018. I'm so excited to welcome you, Cathy. You are the OG of nursing advocacy. You coined the term street nurse. So welcome to the Gritty Nurse podcast.
Oh, thank you. Well, first of all, I love the name Gritty Nurse. That's great. And it's great to talk to you. And I've been following what you folks have been doing, and it warms my heart.
Oh, thank you.
Oh, that's great.
Well, the thing is, if we think about like activism, and like you were probably one of the first people we heard about a nurse who's an activist. So I mean, you're the trailblazer. We're just following we're just following suit. We're just like following really good examples and being like, all right, what else can we bring to the table? So again, yeah, welcome. We're so happy to have you here.
Yeah, so for our listeners who don't know you, Cathy, maybe you could tell us a little bit more about yourself, who you are and what you do.
Sure. Well, I've been a nurse for a long, long time. I graduated from a hospital school of nursing, Toronto General Hospital School of Nursing back in the day, and I worked in cardiology. I worked on the first step-down unit in Canada. It was kind of a step down from a coronary care unit. It was full of all kinds of experimental treatments and modalities. It was very, very exciting. But then I left after I had my daughter, and shift work didn't really work out for me so well, and I ended up in the community. And I've worked on Bay Street in, the financial district for a period of time for doctors that were doing extra billing when it was allowed. Hated that. And then I moved literally to the community. So I've worked as a clinic nurse, nurse practitioner. I've been a public health nurse. I've been a camp nurse. But then about 30 years ago, I became a street nurse. And it was actually a homeless man that coined that term. And this was a little clinic that was run by volunteer nurses. They had no funding. When they finally got funding, I was the second nurse hired. I specifically went to work there because it was nursing based, like not controlled by a hospital or doctors. So that's the majority of my career. I've been doing what's referred to commonly as street nursing, but with tons of advocacy built into it.
Wow. I mean, I have to be honest, I am a little starstruck because it's like we read about you in textbooks and it's just like I'm talking to you today.
And Cathy, I have to say, I read both of your books. I borrowed them from the library. I read them. I thought they were amazing. And just the stories that you tell with the homeless people you worked with, it really just, opened my eyes to that there are a
Oh,
lot of stereotypes around homeless people and everybody has their story. And
yeah.
it all seems like, everyone has a different path in as to how they became homeless or dehoused.
Yeah, thank you. Just before I came on to do this taping with you, I watched a short video that was sent to me by Indigenous woman from up north who is mute and I believe deaf. She sent a YouTube video in memory of a man named Sam Ash who just died last week, and he was one of kind of a core group of homeless guys that some who are in my first book, like the Colonel, and he
Hmm.
was an Ojibwe artist, very very famous. Like his works are in the National Gallery. They're of the woodlands style of painting, and like there's a story right there, right? Like everyone has a story of how they became homeless. And I have to admit that one of the biggest shocking things for me was first meeting homeless people,
Right.
because I had been on the board of Nellie's shelter for women. That was a violence against women shelter. But really, when I first became a street nurse, I was meeting people that, I would walk into a drop in center and hear, Beethoven being played on the piano by somebody, or I would be meeting somebody that actually was going to work every day from a shelter. So honestly, I think that's why I stuck with it for so long, because every single day you were meeting such amazing people. And it's such, as you know, as nurses, it's such a privilege to be invited into kind of intimate moments in people's lives.
Absolutely. Yeah, I mean, I think that we have so much to learn from people who are precariously housed or, who are going through this time where they don't have a home. And I think for our listeners out there, I really hope that, this will be not just like an eye-opening opportunity to learn, but I think we have to see the world in a completely different way. I think for too long we have been seeing the world in one way, like this is how it should be. And I think we can understand and we can appreciate that, there are some things that we'd like to see, but we have to also understand the side where, things aren't that great and we need to do so much better. Like I think
Mm-hmm.
a lot of people say like, oh, our governments, they're doing so hard, they're working really hard. And it's just like when you start turning the other side of the coin, you really start to see the disparities and the health outcomes of these individuals. And we I definitely see the difference in how these individuals may be cared for and how they may be treated differently and how their health outcomes are poorer and how their life expectancy is cut so short. One of the things I wanted to ask you was, what exactly is street nursing and why did you choose this? Because I think there's probably a really good story there as well.
Well, maybe not. Well, for nursing students or nursing nurses listening, I think it'll be a good story. For them, they'll appreciate it. So I was working. I went back to school to Ryerson to get my nursing degree, but also to be able to specialize to work as a nurse practitioner. That was in the days before the new, more recent program. And what I discovered after graduating and working at very progressive community health centers was what I was allowed to do as a nurse in terms of my full scope of care and ability was dependent on who the doctors were at that organization
Right.
and who the board of directors were. And it was very limiting, and it was very it created a lot of what you'd call cognitive dissonance. If Dr. So and so was there for a year or two, you could do well baby checkups and full well woman physicals and prenatal care and home visits. But then if a more nervous Nelly of a doctor was on board, you'd be, you know it would be demanded that you be more of an assistant to them. And I hadn't gone back to school as a single mom for that. So I left, and that's when I left to go to street health. I also wanted to do my master's, and the organization I was at was not going to let me even reduce my salary to be able to go back to school part-time. So it feels a little bit like what nurses are still going through, not being fully respected and appreciated and supported. So it was really those reasons that I went to work at this organization called Street Health. It wasn't because I wanted to care for homeless people at all. And of course, once I got there, it was like night and day from what I expected.
Right.
And what was amazing about it was that it was nursing driven. We also had a HIV/AIDS outreach workers, but the primary staff were nurses. And we worked in a primary healthcare model where we went out to the community where people were. So we did clinics in drop-ins and shelters. And you know what? If our Tuesday clinic at the meeting place fell on Christmas Day, Tuesday, we still did the clinic because people were still homeless. And so there was a lot of commitment to providing open and accessible care. So the term street nurse, it got coined by a homeless man. It was seen as a compliment because at the time, and still, people might refer to somebody as their street brother, who's not really
Right.
their biological brother. So it was seen as a compliment.
Mm-hmm.
Street nurses have worked in a lot of different ways. Some have more of a specialty in mental health. Some might be focusing more on youth. And for me, it was a political term. It was a term saying, look, homelessness has gotten so bad in the country that this nursing specialty has arisen.
Right.
But, I had a Quebec street nurse counterpart or colleague who she had a different perspective. She didn't really like the term street nurse because she said all nurses should be prepared and able to provide healthcare to people that are homeless no matter where they work.
Right.
And I've kind of come around to agree with what she was saying about that because the term street nurse does really leave out families with children that are homeless.
Mm.
It kind of gives you the connotation, or it reinforces the stereotype that if someone's homeless, they're literally out on the street. Of course, that's not the case. There are maybe 7,000 in Toronto in shelters. So it's a complicated term, but for me, it's a political term. And it's over 30 years old now. So
Mm-hmm. Mm-hmm.
the federal budget is happening this month. And
Yes.
I couldn't resist myself. The finance minister posted a video of her new shoes.
Oh my God.
And up till now, I think we've primarily had male finance ministers. And to be honest, I've never paid much attention to their shoes. But Chrystia Freeland is our finance minister, and she posted a picture of her new shoes to wear for the budget.
Wow.
And I could not resist posting pictures of that I have had taken of a patient of mine in his shoes.
Right.
So people can see that it's on my Twitter feed. Just to make the point, right?
It just goes to show how disconnected people actually are when it comes to understanding
exactly.
health.
Exactly. And, a doctor that I quote a lot, Dr. Ritika Goyal, says that the number one determinant of health is politics.
Oh,
And we've
yeah.
certainly learned,
Absolutely.
like every nurse in this country knows that now.
And if they don't, I don't understand how they couldn't. I think
Yeah.
this whole pandemic has shed a whole new light on understanding systemic inequality in healthcare. It is unbelievable. I don't even think people have to really worry about the stats now because it's just it's so blatant, so clear, so disturbing that it's unbelievable.
Yeah, and I've been sort of following, Cathy, your tweets about all of the things you've been advocating for in terms of the homeless population and the pandemic. And so I know,
Right.
obviously, you're an you're an activist, you're a speaker, you've made films, you're an author. I can't even keep track of what you're doing. Is there anything in particular you're working on right now?
So, I have there's a plan in the works to put together a book on COVID and its impact on the homeless population. So I would see it as being an edited book that I would help to pull together with different people that are experts in the field, writing different chapters or sections. So, for example, on the double whammy of the opiate crisis and
Yeah.
homelessness, and just the huge delays in obtaining adequate public health measures for people that are homeless, and what happened when the first lockdown happened, when libraries closed and coffee shops closed, and drop-in centers suddenly had to figure out how do they feed people when they can't have more than X number of people inside their doors. And
Mm-hmm.
so I mean, so that's kind of in the future. Right now it's almost day by day trying to figure out what is the movable mountain,
Right.
what can be achieved right now. And right now it's the speed up of vaccination,
Yeah.
especially in the shelter hotels that we have in Toronto. We have something like 25 to 30 shelter hotel programs, and obviously still a lot of people in encampments. So that's foremost. And of course, our attention as well is on the federal budget. And, I think trying to continue to spread awareness, especially in Ontario, of the drastic mistakes being made by politicians,
Mm.
and trying to leverage more healthcare voices. And I know that you two do that really, really well. And I have to. I wouldn't mind getting your opinion on this. I've really noticed. If you've read my second book, my memoir, I'm critical and also respectful of physicians, right? I've had some very bad experiences, but also some very good ones. A very strong mentor to myself was Dr. Phil Berger. But during the pandemic, I've been stunned by how strong the medical profession has been
Mm-hmm.
in
Uh-huh.
terms of speaking out around social justice. And I can't say the same for nursing, but I'm not trying to fault nurses here.
No, you hit the nail on the head. That is exactly what Amie and I have
Okay.
seen. And, a lot of people say to Amie and I, like, you are the only ones out there. And we don't want it to be that way. We are happy to pass the mic. We don't want to hog the attention. When the media
Yeah.
comes to us to interview, it's not because we haven't tried to involve other nurses. It's because there is this extreme culture of silencing and fear in nursing. And
Hmm.
especially around speaking out, I think everyone refers to that one nurse who I think 5 or 10 years ago spoke out on social media and lost her job. Well, she did fight it in court, and
Hmm.
eventually she was in the right. But I don't know.
Right.
I don't know what it is. Like
Right.
there are about 4 to 5 times more nurses than doctors in Canada, and I can't say
Hmm.
we're represented that way at all. So I don't know if it's just that people aren't coming to us, or maybe people do come to nurses and they're afraid to speak out, or maybe it's a bit of both. Maybe there aren't enough role models.
Hmm.
Amy and I try to role model this activism, being in the media, that it's okay to do that in a responsible way. And I'm hoping that this will just, us opening the doors for more nurses and giving them permission to speak out and showing them that it's okay. And if we don't do it, then who's going to do it for us?
Well, I think it's very, very important that you're doing it. And I've been so pleasantly surprised when I've seen you on TV or Metro Morning, different shows like that. Maybe it was The Current. So I think there's a few reasons. I think medical education has some medical education has changed dramatically. So you see, the wonderful Dr. Nahid Dasani, who
Mm-hmm.
every single time he's being interviewed is referred to as a palliative care physician, but also a health and justice advocate.
Right.
Hmm.
And the media respect that and always include that. And you see many physicians of color as well speaking out. So there certainly power imbalance in terms of how nurses are situated in the system, I think, makes it potentially more dangerous for them to speak out.
Well, I feel
Mhm.
like there's an image crisis, right? There's I go into work every day as a nurse and here's what I do, and then the crisis of, well, here's my thoughts and opinions as a person. And I feel like there are a
Mhm.
lot of nurses that don't know how to put the two together, but yeah, but at the end of the day, they're one person. So I mean,
Right.
I
That's
think
right.
I think this is where you talk about evidence informed information, and that I think our opinions are actually really important. And it's it, we don't learn about social justice in nursing school. Like I remember, I think
Mm.
about it, like yes, we learn about poverty and we learn about some of these things, but we don't actually talk about social justice activism or these various different, like we don't talk about like what is happening in the world that also causes health disparities. We talk about
Right.
all the diseases, the pathologies, microbiology, but we don't get down to the real social aspect. When I did community health nursing, I think it was like one chapter in my textbook, and it was
Mhm.
like the placement was, I'll be honest. Oh my God, I'm going to get in trouble. The placement was ridiculous. The placement I had for my community health was they put me in a school. They're like, do a presentation for grade eights on sexual health. And I'm like, okay.
Yeah.
I see the point, but I think there's so many other things that people can be involved with in understanding what community health and community health advocacy looks like. And I think that's with starting with understanding what social justice is and understanding, like, we learn fundamentally what the social determinants of health are. We read it in a textbook, but maybe it's that opportunity to go out and see what it actually looks like while you're on,
Right.
whether you're on the street or whether you're working in a center where you're actively dealing with these issues, and then like build it into the curriculum where you're doing some work in terms of
Mhm.
policy. Maybe you actually do, you write a letter where you're urging your ministers, your MVPs to actually make change and regarding an issue that you truly deeply care about. Because I can't believe that. I don't think that nurses are these automatons. Like we just, like we get up in the morning, we go and do our work, but we don't think outside of nursing, right? I mean, I think that's, you know what I mean?
Yes, I do. And to this day, somebody will still say to me, "And you're a trained nurse, right?"
What?
Like,
I
well,
still there's like that, like self-taught nursing, like you taught yourself
What?
nursing through a
yeah,
textbook.
yeah.
Oh my
And
god.
No, I'm a
in
self-taught nurse
so
actually.
and so education is really important, and it's not doing nursing very well right now.
Right,
We don't, for the most part, nursing education, we don't learn how to identify a topic that needs advocacy, or
right.
how to create a tool for advocacy, or how to write a press release, or how to use social media for advocacy,
Yep.
or how to organize a community meeting, or how to create anything from a petition to a deputation. I used to take nursing students out until the pandemic. I would take them out on community health and social justice walks, and
Mhm.
we often included City Hall in
Oh,
the walk.
cool.
And then we would go to like Regent Park, and we'd go in and out of grocery stores and all kinds of things. And I always would say, "Who's your city councilor?
Mhm.
Who's your MPP? Who's your MP?" And like no one would know, right?
Right. No,
And
I
so
agree.
my goal at the end was always to make sure you sign up for their newsletters and look them up, because someday you might be a young mom who wants to get a speed bump put on her street
Right,
to stop kids from being hit by the car. So you need to know how to do that.
right.
And anyway, I could go on and on, but I think it's sad that we don't learn about nursing leaders and nurse activists, which is why I did write about a lot of them in my book. And you know, their stories are incredible. I mean, the reason we have second and third generation Vietnamese Canadians now is to do with the nurse,
Right.
Marion Dewar, who was the mayor of Ottawa, and because Canada was going to turn boat people away. And she said, "No, I don't think so," and challenged Canadians and other mayors to accept people in our communities. So I mean, there's a whole bunch of things going on, but I think there's a huge opportunity that COVID will change this. It has to. It's literally a
Mhm.
life and death situation
Mhm.
for people in our community, our patients, but also for nurses. So,
Absolutely. I
um,
I agree. So, if there was one health, and then of course, like actually I was going to say before I even ask you this question, like we can talk about nursing activism as like a whole other episode. Like, I mean, we can go on and on because I think there's so much and so much power in our voice. And I think people just need to find it. I mean, I hope through this podcast they can find it. And I mean, not even just nurses. Like, I think there are other people that are like, yeah, I want to speak up. I want to understand what it's like to be an ally. I want to understand how it is to be anti-racist and all these things. And I really hope that like through these conversations, we can empower that change. So, but of course, maybe we'll have to have you back on and we could talk a little bit more about activism. But if there is one issue, one health issue, and I know this is going to be a tough question, that field demands much more attention and much more light shone on it, what would that be and why? In terms of, in terms of the work that you do.
I have to say, housing and homelessness.
Okay.
But in a very broad sense. I mean, people, I've been having a lot of arguments with people lately around this issue because people kind of get so happy and excited when we learn that, 60 60 modular housing units are going up and all homeless people that need high level supports are going to get housed. People get really excited about that, but that's a very like American model of dealing with homelessness, and
Right.
we need that kind of housing, but we need housing for all. I mean, the reason that we have these hot spots in Toronto, it's in part because of people working in non-unionized settings that don't have sick pay,
Mhm.
paid sick days rather, and and we have lousy transit and all of that. But it's also because of the housing they're in, very dense, crowded housing. And we in Canada have always, patted ourselves on the back for our social programs such as Medicare.
Right.
Well, we used to have a national housing program, and we don't any longer. We have a patchwork of something called a national housing strategy. And we're not building 5,000 units of housing in Toronto every year or 20,000 units across the country like we used to
Wow.
when we had a program. So, in a way, it would be like Medicare if we had Medicare that was only for a certain person or a
Okay.
certain diagnosis. So, in many ways, what we're getting with this modular type of housing that's going up, and as well, Toronto just got money to purchase two buildings. They've purchased an old empty retirement home and a hotel on Spadina. That's fine. That's all totally necessary. But if that's all we ever do, then all we're going to be doing is creating. A friend of mine uses this term apartheid housing, and
Right.
that might sound really strong,
That is,
but
yeah.
that's if we're only going to clump people all together and not care about the housing needs of like students and seniors and working families and the people that are working in factories, and it's all of us that need good housing. I live in co-op housing that was built down near the St. Lawrence Market area when we had a national housing program, and it's a mixed income community. And so that's the issue, because for me, it all comes down to that. It all comes down to whether you have affordable housing, and after you pay your rent at the first of the month, you have enough money left for, you know, new running shoes for your kids and
Right.
a
Yeah.
bus pass and food.
Yeah.
This all just sounds so simple, but I mean, obviously, it's more complicated than we realize because if that was the case, I feel like this would have been addressed already. And I'm even thinking in terms of the pandemic, when we ask somebody to self isolate for 14 days, if they live in a bachelor apartment or they don't have a single room that they can stay in, how are they physically going to do that? We're asking people to do things that they physically can't do. And so I think that's
Mm-hmm.
contributing to the problem, in addition to lack of paid sick days and the transit situation. Like there's just so many layers, I think, that people don't really understand. Um,
Right.
This is where I was feeling like, or understanding that it's like the government's so out of touch. Like, I mean, he backpedaled so quickly when it came to like shutting down playgrounds. And it's like, if playgrounds are more that important, we should really be talking about paid sick days here, right? Like it's just like the things that are most important to those people in government they're just like fully missing the mark. Like I don't know
Mhm.
how much more we have to scream about the disparities of the health outcomes that we're seeing in specific groups of people for them to actually
Mhm.
understand what the problem is.
Someone today said something really interesting. I think it was on, might have been on CBC on the National or something this morning. They said that Premier Ford should be given the advice that he not give out his personal cell number because everyone has it. But the people
Yeah,
that are getting to him to lobby him, like he's been lobbied because he's not listening to his science advisors, obviously.
right.
So in terms of the federal level and the provincial level, when it comes to housing and dealing with poverty and social programs, they made decisions many, many years ago before they were even in power, their predecessors, to pull back from funding social programs, to rely more on the private sector, et cetera, et cetera. So it's not that they don't know how bad things are. They do know.
Right.
I'm convinced they know. And thank goodness, it'd be interesting to analyze the backlash that happened that made the premier go back on his decisions around the extra police powers and closing down the parks. That was where I think, Twitter did something.
Right.
But you're right. Like, so what next can we do to win paid sick days? Um, it has to happen. Like
Yeah,
literally, it's
it
life or
really
death.
has to happen. And I mean, it's like they need to the next thing is like looking at some of these huge warehouses. Like I've been told some pretty horror stories. Like I've been told some really horrible things about Amazon. Like I know someone who their boyfriend, or I should say fiance, works at Amazon, and some of the stuff I was hearing, I was just like, oh my God. Because he was
Mhm.
saying, he's like, yeah, I know there's all these people with COVID-19. He's like, they're not shutting it down. They know. He's like, it's an
Yeah,
operation. It's like it's a full on operation here. They're not changing anything because there's a very strict guidelines in how Amazon has to run, how
yeah,
some of these dimensions and some of these protocols that this organization sets up.
Hmm.
And then even hearing about, like, I have a family member who's a construction worker, and he was telling me about some of the, like, he told me about the site that he was at that had this huge outbreak, and he's like, "Yeah, nobody wears masks. Nobody," he's like,
that's right.
"Nobody does any of the social distancing." He's like, "They don't care about us." He's like, "I'm contracted for work. If I was to say something, they would just fire me." And I'm like,
Really?
"Yep." And I was
Oh,
just like, this is what's scary, right? Like they're all in these types of environments where, they may be contracted out to do the work. And if they were to speak up out against their employer to say, "Hey, we should be social distancing while we're doing this work. We should be wearing masks." He's like, there was not one person on his site that ever wore a mask. And I was just like, wow. But I mean, not we, I shouldn't say we, but the government is allowing this to happen. They can't not know,
That's correct. Yeah.
right?
hmm.
And this is where I keep on saying we have to continue to hold their feet to the fire. We have to hold them accountable, and we have to let other people know, because I think, unfortunately, some people get their news through Twitter. Some people get their news through Instagram, whatever. But if this is the way that we can get it out to them, then let's get it out. We need to spread the word. We need to let people know what's actually happening. And whatever modality works, I'm going to use it, because I think we have to inform the public of what's really happening when it comes to, homelessness, paid sick days, what's happening when it comes to understanding the inequities and the social inequities that we're seeing and the health
Right.
outcomes. It's like it's this huge domino effect, and we can't continue to allow it to happen.
Well, the eyes of the world, I think, are on Ontario now.
Yes.
The the New York Times had a very powerful article around homelessness. A couple of the doctors that I mentioned earlier have been on both CNN and
Yep.
another European Al Jazeera, British or English Al Jazeera.
Hmm.
That's huge.
Yep.
Um,
Yeah.
and so it's kind of, yeah, it's like I always describe, this might sound silly, but I use the metaphor of nursing as like being like a dance, because you have to be, like, when it comes to advocacy and political action, you have to be nimble and creative
Hmm.
and figure out what can we do now that will work, because there's always something that you can do that will move the issue an inch forward
Yeah.
or more,
Mm-hmm.
there's always something. And it's actually kind of fun sometimes trying to figure that out. It's not fun right now, but
No.
Yeah.
Gosh, yeah.
because we're so far behind with trying to win paid sick days.
No, it's true. I like how you describe it as a dance because I was talking to somebody the other day and we were talking about the media and nursing, and I had made the comment that especially like in interviews we do, sometimes we like to push a little bit. Like we will go a little bit off topic to cover the things that we feel are important if we're being asked a
Right.
question that we feel isn't super relevant. So it's sort of like you said, doing a dance or finding that person that you think could help amplify your voice and just nudging them in the right direction. And it's very, I don't know, it's strategic. And I think with the pandemic, we've had to become really savvy on social media because it's the way that we reach people these days. We can't do
Yeah.
talks right now. We can't do all the things that we wanted to do from before. And just getting back to street health and street nursing, I think there are a lot of things that people, they want to help the homeless, but they're not sure how. And,
Right.
I have a friend that makes these personal care packages and hands them out to the homeless. But I think the best thing to do, in my opinion, is to ask people who live on the street or who are, in precarious housing, like what would help them. And my question to you would be, if you could tell us what are some tangible things that we can do right now that would help, have better health comes on the streets. Like what sort of
Sure.
things do you see as important?
So I have a slide that I use in presentations, and it's a formula called a third, a third, a third. And it refers to exactly your question: what can people do if people want to help? So the formula refers to so whether it's your time, your energy, your letter writing, um, your donations, your advocacy, think about allocating a third of that to what we call downstream. So to people like literally on the street or in encampments, or to organizations that directly help them. So that could be a shelter that's in your community. It could be the Encampment Support Network, ESN, which has a website and a newsletter, and it tells you exactly what they need. And then another third is for the upstream solution. So that would be housing. So obviously, one or two or three people can't, build housing, although Khalil Seavright, the carpenter in Toronto, did do that. But so allocating a third for upstream. So that means figuring out in your community, is there a supportive housing project that's being built that could need support? So for example, in Toronto, the most recent one that opened is called Friends of Ruby, and it's an LGBTQ transitional housing at Dundas near Sherbourne. So it's built, it's done, but they don't have, I imagine they don't have a huge operational budget. So it could be calling them and saying, hey, it's my birthday and people are giving donations. What do you need? And then
Right.
they might say, oh, we need knapsacks for, teenage girls or boys or something. Or maybe they'll just say, if you can donate to us, that would be great. And that applies anywhere. There's always some project like that that's been built. In Toronto, there's another fairly recent one, is the housing that's run by the Y, that's near the bus terminal, and it has a large number of Indigenous women there. So same kind of thing. And then the other third, the last third, is support advocacy efforts. And same thing, whether it's your money, your donations, you're signing petitions, do those things to support advocacy groups. And they're easy to find on Twitter. The main ones right now in Toronto are the Shelter and Housing Justice Network. Encampment Support Network is another one. Ontario Coalition Against Poverty is another one. Surge, SURJ. So they're easy to find on Twitter because they're all very, very active. But then also get on your city councillor, your MPP, and your MP's electronic newsletter so that you can see what they're doing, because there's always something going on that they're not doing. So, for example, right now in Toronto, pretty much one of the main fights right now is to stop the mayor and the city council from evicting homeless people from encampments.
Right.
So that's actually going to be a court battle. So I always say, like, just think about what you can do. If you're a nursing student, do whatever you can to try to insert more creative options in your curriculum for projects that you want to do. That's really hard. My experience has been that across the country, there's usually kind of only one nurse professor in each nursing school that could be mildly considered like an activist. I'm not kidding, like one,
Wow.
with the exception maybe of University of Victoria. And McGill has a nursing student activist group, and so does Ryerson.
Yeah.
Wow.
So, there's always ways to find connections. And, just every chance you get, if you're a regular library goer, tell them to order more books on these issues,
Yeah.
or, things like that.
Wow. No, those are really helpful. I mean, it's helpful for me because like there every once in a while I'll say to my husband, because like when I was raised kind of in a church or whatever, so we did a lot of like soup kitchens, doing stuff at Christmas time with families, Operation Christmas Child, or learning about how can I do better for not just myself but like for my community. So I mean, anything that's tangible, I think it's really important that other people can know them and do something with them. So is there anything else that you'd like to add that we didn't touch on today?
Well, I just think you guys should just keep doing what you're doing because it's
Oh,
pretty exciting and
Mhm.
inspiring. And if ever, I'd be happy to give you a couple of my books if you ever want to do door prizes or
oh,
prizes or
that's
anything like
Oh,
that.
lovely.
that'd be nice.
Just be in touch with me, and because I've got a box of them in my apartment.
All right.
Um, no, I think that's just for people listening. Just know that people really, really, really respect nurses. But I say that with a big but, because
Mm,
it feels like in the pandemic, nurses have just been expected to full out do the hard work,
yeah.
and it's really rare that you see nurses being turned to and listened to for advice. So it's kind of it's a time where we have to be stronger and have our voices heard, um, because the general public honestly thinks so highly of nurses. It's such an honor, that is the case. And I think politicians and the media have to be reminded of who we are and what we do
Mhm,
and what we
mhm.
demand.
Absolutely.
Um, and you know, nursing unions and RNAO, the professional group, they can be there, but they're also large, big institutions,
Yep.
and so I think grassroots is really important. And um, there's a Street Nurses Network in Toronto, and there's also a group called Health Providers Against Poverty. Those are good groups to follow if you're interested in the issues of poverty, homelessness, racism as well. So just so much to learn. I learned none of this in nursing school. It all came later.
Yep.
Mhm, mhm.
So if I can do it, I use this Julia Child, Julia Child, the famous chef. She said, I won't mimic her voice, but she says, I could try, I suppose, but she says, if I can do it, you can do it. Let me show you how,
Yeah.
and I think that's a little bit what I've tried to do. And
Yes.
certainly I think what you guys are trying to do. So I'm so happy that Gritty Nurse exists.
Oh,
Oh my
and
goodness.
we're so happy that we have you as a role model to look up to. Like, honestly, this
Absolutely.
is a really, really great episode, I think. I'm hoping that our listeners will get a lot out of it. I know I have.
Oh,
If
for
our
sure.
listeners wanted to, drop you a line or reach you, what's the best way for them to find you, Cathy?
Yeah, so I have a website. It's simplecathycrowe.ca, and you can email me. There's a spot on the website that you can write to me. And can I ask you one question before we go? Like, how did you come up with the name Gritty Nurse?
Oh, this
Oh,
is so
that's a
funny.
good question.
So,
Amy, you want to tell your version of this story?
sure. I mean, I think so. Sarah and I kind of had an idea that we wanted to talk about nursing, and we wanted to talk about it in a way that most people wouldn't have understood the profession of nursing. I think people have an idea of what it's like to be a nurse, but they don't truly know. And we had our own various experiences that kind of helped push and drive us towards to doing this work, to podcasting, to speaking out openly, being activists and whatnot. And I think we were we were mulling over names, and I don't know, that it just hit me, and I was just like, we're gritty nurses. And because I know I hear nurses use this word, and other health professionals all the time. They use the word resilience, and I have to be honest, I hate it.
Mm.
I just there's something about that word that just it doesn't sit well with me, because I've heard it used in a very negative connotation as well. Like, if you're not resilient enough, and I felt that grit really talked about resolve, really talked about that determination, that perseverance, that in your gut gusto, that I'm gonna get it, I'm gonna hit it as hard as I can, and I'm gonna use the passion and the force and the love and the care and compassion that I have behind it to make it powerful and impactful. So that's how we came up with us being called the Gritty Nurses.
Oh, I love it. And Sarah, your version?
Well, my version that I recall is that Amy just kept saying, "How about gritty nurse? How about gritty nurse?" And I kept thinking of other descriptor words, and like I was doing Google searches to see if anybody else had come up with the name, and nobody had. And I thought it was pretty catchy. And when you're trying to stand out
Right.
when you first started, you don't want to be mistaken for someone else. So it seemed like nobody had really used that term, and I thought, okay, well that sounds fine. So then we got to work and started designing our logo and making all of our social media handles, and
Yeah.
yeah, it just kind of stuck. We never thought to change it afterwards. It was like we
Great.
had this conversation
Yep.
and it was set in stone, and here we are a year and a half later.
Well, that's great. I'm glad I asked.
Thank you so much again for coming on and talking to myself and Sarah. Honestly, it was a pleasure. I mean, I think there's no book that'll do talking to you justice. Like, I'm still so excited. And I mean, I really hope that, the nurses, the physicians that listen, our other listeners, that we're always still trying to find out, like, who actually listens, because I think we have such an eclectic group that listens. But I mean, I feel that there's something in this for everyone, and I think that's the whole point of us having these conversations. And again, I'm so glad that I had the chance to meet you, talk to you, and learn from you personally. Thank you so much.
Thank you.
Well, you've made my
Oh my
weekend,
goodness, are
so
you
thanks.
serious?
Yeah, no, really, it's like when you find somebody like-minded, it's really helpful, especially in these times.
Yeah, we are definitely in this together.